In this video, we will be demonstrating corrective exercise training for a specific issue that is commonly seen during the overhead squat, which is the knees moving inward, or knee valgus. This is caused by hip internal rotation and adduction. When this is found, there are overactive muscles to be tended to, such as the lateral gastrocnemius, the adductor complex, biceps femoris, and the TFL, or the IT band. So this client has demonstrated the knees moving inward during an overhead squat. Now we will be moving on to step 1, which is the
Alright, so now we are targeting
technique,
4 areas that are
rolling,
considered to be overactive when the knees move inward, or valgus, during the overhead squat. So, first we will have the lateral gastrocnemius,
the biceps femoris,
or hamstring complex, the adductor complex,
and that IT
and
band.
TFL, or the IT band.
Not everyone's
These are the 4 areas that will be targeted with our foam rolling series.
Area to target.
Foam rolling is step 1,
overactive muscle
which is also known as the inhibitory technique,
and improve functionality and dynamic
This is the
movement
system
performance.
used when applying corrective exercise training to help
The inhibitory
correct
technique,
overactive
also called
and underactive muscles to help better
has the purpose
perform
of
dynamic movements such as the overhead
tightness
squat.
in the muscles that are targeted. In other words, decreasing some of the overactivity
Common
that is
reasons
found
for
and causes
knees moving inward during the
knee
overhead
valgus.
squat would be things such as sedentary lifestyle. For example, this client works a desk job and has for 15
As you
years.
can see, we have
She also has a history of
to
hip bursitis
the hamstrings,
and is recovering from a broken foot.
and the client,
As you can see,
is being
we
instructed
have
to
foam rolled
continue
the
foam
lateral
rolling
gastric and have moved on now
while
to the
managing their
biceps
breathing
femoris.
and allowing the muscles to slowly release, little by little. Now, while foam rolling the biceps femoris, we are targeting specifically the short head. Now, moving on to the adductor complex. These muscles tend to be very overactive when the knees are moving inward. And in contrast, it is the abductors that would need to be strengthened to help keep the knees from moving inward. But by loosening this area, we can also help to prevent some of that. Following the inhibitory technique will be the lengthening technique. Now, by lengthening, we will be performing static stretches, which should be generally held for about 30 seconds on each side, while still maintaining a flow within the breath, allowing the muscles to find a release, and lengthening the overactive muscles that we have targeted in this inhibitory technique, otherwise known as our foam rolling series. Now, as we finish up these IT bands, it is really important to note that foam rolling is a very helpful tool that can be done at home, in the gym, as a precursor to training, as well as a follow-up to any workout. Helping to take care of our bodies really is like maintaining an automobile. It takes regular attendance. So it's important to share with our clients these tools that they can easily do at home. Now we've moved on to the next step, our lengthening. So we are stretching statically, and we'll just be breathing and holding our stretches. Now, starting off with a butterfly stretch, we're holding above the ankles, so we have a firm grip, keeping a long spine, and gently using the elbows to press the inner thighs down and out, or press gently on the knees. Now this is lengthening the adductor complex, again, one of the overactive areas that is correlated to our knees moving inward in the overhead squat. So again, that is the movement that we are trying to correct. Now taking it out to a wide leg forward fold. Again, stretching out this adductor complex, keeping the knees and toes pointed upward with the long spine, keeping the breath flowing, and letting those adductors and that inner thigh lengthen out. Bringing one sole of the foot inside that right inner thigh. We're taking a side stretch, still targeting those adductors, getting a little added side body stretch to the obliques. Keeping the breath flowing. It's important to always keep that breath flowing while we're doing static stretching. So now we are going to move on to a static stretch for the lateral gastrocnemius. A simple lunge position here, stretching out that lateral gastroc. Breathing deeply and holding it for about 30 seconds on each side. Again, this is helping to calm down the activity in some of these muscles, and over time producing that correction there so that when the squat is performed, the knees and toes remain parallel and they do not cave inward. Great. So now after our static stretching will come our active and dynamic series. Now first, we're going to start on our hands and knees. Now, some of this could be done differently. We could use ankle weights. We could even go to the cable machine. But we're going to do body weight to show something that could be even done at home. So what we're doing here are glute kickbacks. Now, we have to strengthen the underactive muscles. So our anterior and posterior tibialis and our glute medius and maximus are the ones that would be considered underactive when the knees cave inward. Again, that's the anterior and posterior tibialis and the glute med and maximus. So here we're having some isometric holds for about 2 seconds at the top of our glute kick-ups. The foot stays flexed. You see a long spine, shoulders over the wrists, top of the head reaching forward. Breath is still flowing. So this is our active series. Our isolated and positional strengthening techniques. Now, if this client was maybe just a little bit more advanced in her strength training, we could have done these kickbacks on a cable machine. But here we are still targeting the glute, med, and max. And now we've moved on to the other side. Again, we have some slight isometric holds here at the top for about 2 seconds. We're holding it and then letting it lower down and tap the ground softly, squeezing up, holding it, allowing that tap down with the toe. It's important to do about 10 to 15 reps with the 2-second isometric hold, 4-second eccentric contractions, so a nice slow lower down to the ground. A way to take this same exercise to the next level for this client would maybe be to continue on the hands and knees with this series but add an ankle weight and then move to the cable machine. Here I just had her stretch back to a child's pose just to rest after those kickbacks. Our next series here is going to be our dynamic movement exercises. We could do wall jumps, tuck jumps, 2-foot long jumps, single leg hops, or cutting maneuvers. For this client, we're going to keep it simple with 180-degree jumps because she is recovering from a broken foot. So, we will demonstrate just a few of these, and this again would be our final step, which is our integrated dynamic movement exercise. The client will be performing 180-degree jumps. It is important for her to land toe, ball, heel, and to let some of the shock or the landing absorb by letting her knees bend into it. Just a quick 180 jump for her dynamic movement exercise. So that was her first trial jump, and she's going to perform a few more here. And again. And that is it for our corrective exercise series. Now, just to show the difference between the squat with her knees coming inward or valgus, she's going to perform a squat with the proper alignment. Knees stay pointed over the toes. Knees and toes, legs are parallel. Once from the side. Good work. Excellent.